Peptic ulcer. I hope you know you can get peptic ulcer by kissing somebody. Yes, by kissing somebody, eating contaminated food, drinking water that are not safe, eating food that are not properly cooked, or you don't even know how these food are made. So we're going to be talking about peptic ulcer, the causes of peptic ulcer, how to prevent peptic ulcer, and the treatment or management of peptic ulcer. So this peptic ulcer is so easy that you can get it from your family member by living with somebody. Usually most people get infected when they are kids, okay, because of kissing and some environmental sanitation issues. Okay, so it's found the bacteria that causes this can be found in the saliva. Okay, it's found in saliva too. So if you have peptic ulcer, you're living with people, you also need to be careful. So please listen attentively and let's get to it. Peptic ulcer is caused by a bacteria called H. pylori. Now, this H. pylori, when it finds its way into your stomach, it infects the lining, and it could cause duodenal ulcer or gastric ulcer. Okay, now let's talk about the causes. Number one, H. pylori. Number two, how you can get peptic ulcer is smoking. Yes, if you're smoking, it increases your chances of having peptic ulcer. In fact, let me use this medium to tell you that if you're treating peptic ulcer, you're treating ulcer, and you're smoking, you're wasting your time, you're wasting your drugs, because the sore will not go. So stop smoking if you are treating peptic ulcer. Now, smoking, another way that you can get this peptic ulcer is stress. Okay, stop stressing, physically, emotionally, and otherwise. It can increase your chances. Another one very important is abusing non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, naxoparin. These drugs will cause peptic ulcer, especially when you take them without food. In fact, if you have ulcer, don't take these drugs that I just mentioned. It will aggravate it and it causes it too. So don't abuse them and don't take it if you have peptic ulcer. You can take, in place of them, you can take paracetamol, and don't abuse paracetamol. Remember, abusing it can cause kidney failure. I've already explained this. Okay, so another way you can get peptic ulcer, I've heard there's been a research about you getting hungry. Okay, not eating or skipping meals can cause peptic ulcer. Well, this has not really been established, but from my own research, I think this is how, when you skip meals, how it happens. Now, when you are hungry, remember, there are times you've not eaten, maybe you've not eaten for hours, you're not hungry. Then you perceive food. Somebody is smelling, you perceive food. You remember, you start get hungry instantly, right? What happens is that time there is an acid that your stomach produces. This is called hydrochloric acid. This acid, when you eat, it acts on them and deaminates the food. Okay, now when you perceive that food you've not eaten for a while, this acid thinks that your brain sends messages to your stomach. So this acid are produced in numerous amounts, thinking that you are about to eat. Now, when this acid don't find food, it may erode the lining of your stomach. Okay, now there is a measure in place to make sure that this acid is diluted. Some people don't have a lot of this alkaline. There is something that dilutes it. Let me not just go for that. However, so the bottom line is, sometimes when you've not eaten for long and you're hungry and you don't eat, because of those acid, it can erode your stomach and cause, this is acid I'm talking about. This acid, when you pour it in your skin, it will finish it, it will peel it, it will erode your stomach. Let's get to the prevention of peptic ulcer. To prevent peptic ulcer, number one, stop smoking if you're smoking. Number two, reduce stress. Number three, drink lots of water. Even if you're fasting, drink water. This will help you calm the hydrochloric acid in your stomach very well. Number three, make sure that you live in a good the food you eat is well cooked. well, drink good water, and maintain good environmental sanitation. Do not always eat out, because you don't know how these food are prepared, the medium of which these food are prepared. So be careful of what you eat and where you buy your food. Okay, now let's get to how to manage peptic ulcer. Meanwhile, if you've not subscribed to my channel, I don't know what you're waiting for. Subscribe. Treatment of peptic ulcer, you have to be diagnosed. Okay, and how to be diagnosed is when you get to a hospital, they'll give you something to put your fixes inside, and try to find out if there is a presence of occult blood and the H. pylori. Okay, so whenever you've been diagnosed, okay, this is what you should do. When you're giving drugs, please, your antibiotics, take them judiciously till they finish. Okay, when they finish, still continue the ones that they've, for instance, they say take 2 weeks in, then take after 1 week continue. Take it in that order so that the bacteria can be wiped away. Now, these are the things that you will do that will not help, that will help you, and don't aggravate the symptoms. For instance, stop smoking. Smoking will make the wound exacerbate. It will make it slow to heal. Remember, this is a wound in your stomach. Okay, depending on where it is, if it is duodenal or if it is gastric. Okay, so stop smoking. Right now, mind the kind of food you eat. Avoid caffeine, coffee, avoid carbonated drinks. Okay, avoid alcohol, avoid food that you notice that irritates you when you like spicy food. There are some food, like for instance in Nigeria, this garden egg food that like is coarse. When you eat it, is coarse. Okay, you need to avoid them. For instance, garden egg, beans, anything that at the end of the day there is chaff that when it pesters on the wound in the stomach, it's going to aggravate it. Okay, I've told you to avoid alcohol, or you can stop it. It exacerbates the symptoms. And when you're treating peptic ulcer, the drugs they gave you to take, make sure you finish them. When you finish them, still go back for checkup. Ask your doctor if you're another course you should take. Please don't take apple cider vinegar. For people that want to lose weight, you will be tempted to take apple cider vinegar. Don't take it. It will exacerbate the peptic ulcer. Avoid fatty foods. Fatty food, fry. If you have peptic ulcer, just avoid all those fry thing. Avoid fatty foods. Okay, avoid chocolates, and alcohol. This can exacerbate your peptic ulcer. Now, I forgot to mention, please stop taking these drugs I mentioned earlier. Okay, stop taking them, ibuprofen, diclofenac, and you can take other ones in place of them. This will aggravate the symptoms. Okay, so let's talk about the foods that aggravate this peptic ulcer, the food to eat and the food to avoid. You have to avoid milk. Before, they used to tell people to take milk. Well, milk makes you produce more acid. It's no longer, there's things that are in place of milk. For instance, these drugs, magnesium sulfate, these drugs they give you that are in liquid form, these things is now replacing milk. So if you're taking them, there's no need of taking milk. However, you can take yogurts that have probiotics in them. Yogurts are very good. They have good bacteria. Okay, they are very good for you. Then you can take you can avoid taking citrus, that's oranges, because it's acidic too. And if you're eating things, anything, everybody is different. There are things that that you eat. Once you eat it, you feel more pain. Don't eat it again. Avoid it. Okay, you can pear is good for you. In our dialect, in African food, well, you can take pap, you can take akara balls, you can take bread, you can take you can take fufu, things that are bland, that are is not coarse. This is better. Okay, I've run out of food now, but you, at least you're having an idea of the things that you should eat and the things you should avoid. Okay, so let me know if you have more questions. I will do a